Backache refers to pain in the back that arises from muscles, joints, nerves, or other structures in the spine. It's the most common problem that affects most people who work sitting at one place. Because of lack of movement and stretching and some other reasons like improper posture, hunching, and twisting, the back muscles become stiff or tense. Pain can either radiate from the upper region to the lower back or may be specific to certain points along the spine. Backache can become really irritating when the pain is constant, irrespective of movement and sufficient rest. Generally, backache that is not caused by a serious condition gets better within 12 weeks with proper exercise, topical gels, sprays, and corrective measures for posture. Prolonged backache may be due to a serious condition like a slipped disc. In this section, you will find tips to prevent back pain. The human back is made of a number of elements: vertebrae, muscles, nerves, intervertebral discs, and the spinal column. When either one of these components is injured, strained, or is out of alignment, it leads to back pain. Often in the case of back pain, the pain can radiate to other adjoining areas like the abdomen, flanks, down the legs, or around the buttocks. In cases where the back pain is higher up, just below the neck, it can lead to pain down the arms and in the shoulders. Here are a few common causes of back pain you might not know about. The most common reasons for back pain are usually bad posture, abrupt or awkward movements, lifting things with bad posture, straining your back, etc. But apart from that, there are some conditions that can lead to back pain. Some of them are ruptured disc. This is a condition where the intervertebral disc gets ruptured or torn due to strain or injury. When this disc that cushions the area between the vertebrae is injured in any way, it can put pressure on the nerves, leading to back pain. Bulging disc. This is where the disc has been compressed and bulges, leading to a compression of nerves. Sciatica. This is a condition where the patient experiences a sharp shooting pain down the back and buttocks. Arthritis. In people with arthritis, their bones are already a little brittle and in a state of degeneration. It is commonly seen that those suffering from osteoarthritis commonly suffer from back pain. Abnormal curvature of the spine. This is where the spinal column, instead of being straight, is curved in either direction. One condition where an abnormal curvature of the spine is seen is scoliosis. Osteoporosis, also known as brittle bone disease, this condition can also lead to back pain. Cauda equina syndrome. This is a condition where the spinal nerves form a bundle at the base of the spine. This condition leads to pain, tingling, and in some cases numbness down the buttocks and spine. Apart from these, other conditions like cancer of the spine, infections of the spine, pelvic inflammatory disease, shingles, and a bad mattress can all lead to back pain. Risk factors. Women and pregnant women. These people are most likely to suffer from back pain. This is usually due to a change in posture and excessive pressure on the back. Old age is also another factor. As people age, their bones and muscles tend to become weaker and more worn out, leading to back pain. Obesity. People who are obese usually suffer from this condition due to the fact that their weight puts a lot of pressure on the area. Another reason for this is that obesity also leads to a drastic alteration in one's hormonal levels, which might sometimes lead to leaching of bone mass, making them brittle and more prone to displacement and pain. A sedentary lifestyle. When you don't exercise or sit for long periods of time, the back becomes inactive and increasingly weak. This can also lead to back pain. Strenuous physical activity. This is observed among people who do strenuous activities repeatedly that require bending at the back. The repeated action and constant wear and tear of the back can lead to back pain. Apart from that, doing an activity improperly can also lead to the same symptom. For example, bending to pick up a heavy object. Anxiety and depression. According to a study published in the Spine Journal, anxiety and depression were linked to back pain. Although the exact reason for this bizarre correlation is still to be studied, the researchers found that people with depression and anxiety reported more incidences of back pain. The most obvious symptom is back pain, but along with that, there are symptoms like tingling down the arms or legs, pain radiating to the front of the body, numbness down the buttocks or legs, weakness of the legs or hands, and an inability to grip properly. And, even bending or looking around could be symptoms of something more serious. The diagnosis of the reason for back pain usually involves a physical examination, MRI, X-ray, or CT scan, depending on the structure that is thought to be causing the pain. In severe cases, a bone scan and EMG may be required. While a bone scan checks for the strength of the bones involved, the EMG scan or electromyography involves testing for the function of the nerves around the area. The treatment for back pain is usually based on the cause of the condition. In some cases, you may be required to take painkillers or NSAIDs, which are non-steroidal anti-inflammatory drugs to help with the pain. Other treatment modalities include surgery, which is mainly done to correct the defect causing the pain. Apart from that, you may also be advised to get physiotherapy to help heal an injured back. The prevention of back pain is fairly simple. Here are some methods. Make sure your posture is correct and safe for your back. Avoid slouching and keep your back straight at all times. While picking up heavy objects, make sure you bend at your knees to pick up the material. That way, you will use your thigh muscles to lift the object rather than the muscles of your back. Sleep on a comfortable bed and make sure your pillow is not too high. Exercise regularly. This will ensure the muscles of your back are strengthened and will prevent the onset of injury. Eat healthy foods that are rich in vitamins and minerals, especially calcium. This will slow down the loss of calcium from your bones and keep them strong. Thanks for watching. Come along with me on the next journey. Till then, please like, share, and subscribe to the Knowledge Hub.